Would you take a medication for erectile dysfunction every single day, even if you didn't need it? It may sound strange, but thousands of men around the world are doing just that. And the reason? It's not just about performance in the bedroom. Some claim that daily Tadalafil boosts blood flow, lowers blood pressure, protects the prostate, even improves mood. But here's the real question. Could taking Tadalafil every day actually harm your heart, trigger dependence, or silently cover up more dangerous health issues? Why are some doctors now recommending daily use? And what are the long-term consequences that aren't being talked about? By the end of this video, you'll discover a surprising side effect that only shows up after months of daily use, and it could change the way you see this drug forever. Stick around, because this information could protect your health or even save the life of someone you care about. Tadalafil, most commonly known under the brand name Cialis, is a medication originally developed to treat erectile dysfunction, ED. But over time, its use has expanded, and today, it's also prescribed for benign prostatic hyperplasia, BPH, and even pulmonary arterial hypertension in specific doses. Here's how it works in simple terms. Tadalafil increases blood flow by relaxing the muscles in your blood vessels. That's why it's effective not just for ED, but also for conditions where better circulation helps, like high blood pressure in the lungs or urinary issues related to the prostate. But here's where it gets interesting. Tadalafil has a longer half-life than most other drugs in its class. It stays active in your system for up to 36 hours, earning it the nickname the weekend pill. Because of this extended duration, some people, and even some doctors, began experimenting with daily low-dose Tadalafil, typically 2.5 mg or 5 mg per day, instead of taking it on demand. And many users reported something unexpected. They didn't just experience improved sexual performance. They noticed changes in blood pressure, improved urinary flow, reduced inflammation, and even better confidence and mood. This growing list of reported benefits has led to a new trend. People taking Tadalafil daily, not just for ED, but for general wellness. But is that safe, or are we crossing into dangerous territory? In the next chapter, we'll reveal some surprising benefits of daily Tadalafil use, benefits you've probably never heard about. But are they too good to be true? Let's find out. When most people think of Tadalafil, they think of one thing: treating erectile dysfunction. But science, and thousands of user experiences, have begun to reveal a deeper story. Let's break down some of the lesser-known, science-backed benefits of taking Tadalafil daily, and why this little pill is getting attention far beyond the bedroom. 1. Improved circulation and cardiovascular support. Tadalafil is a PDE5 inhibitor, which means it helps dilate blood vessels by increasing nitric oxide availability. The result? More blood flow, not just in the genitals but throughout the entire body. This has led researchers to explore its potential for improving vascular health, especially in people with early-stage hypertension or circulation issues. Some studies even suggest it may help in reducing arterial stiffness, a key risk factor for heart disease. 2. Reduced symptoms of benign prostatic hyperplasia, BPH. Tadalafil has been officially approved for treating BPH, a common condition in men over 50 that causes frequent urination, weak flow, and nighttime trips to the bathroom. Men taking daily Tadalafil often report fewer urinary symptoms, better bladder control, and even improved sleep as a result. 3. Lower blood pressure, especially in the lungs. At higher doses, like 20 mg, Tadalafil is used to treat pulmonary arterial hypertension, a serious condition where the arteries in the lungs are under high pressure. Even at lower doses, daily Tadalafil may help gently reduce systemic blood pressure, which could benefit people with borderline hypertension, but only under medical supervision. 4. Anti-inflammatory effects. Emerging research points to possible anti-inflammatory properties. Inflammation is a root cause of many chronic diseases, including heart disease, diabetes, and cognitive decline. Could Tadalafil be doing more under the surface than we realize? 5. Improved mood and confidence. Though not its primary use, many users of daily Tadalafil report boosts in confidence, mood, and overall well-being. Some of that may be psychological, due to improved sexual performance, but part of it might also be linked to better circulation and hormonal regulation. Quick reality check. These benefits sound impressive, right? But are they consistent? Are they safe? And Most importantly, do they outweigh the risks? Coming up next, we'll explore why daily Tadalafil has suddenly become so popular and why so many people are choosing to take it without a prescription. You might be shocked to discover who's pushing this trend. Not long ago, medications like Tadalafil were reserved for doctor-prescribed use, often in private conversations about erectile dysfunction or prostate issues. But in the last decade, something has shifted. Daily Tadalafil is no longer just a medical treatment. It's becoming a lifestyle choice. And here's why. 1. The wellness and longevity movement. Across social media, influencers and even some health coaches are promoting Tadalafil as part of an anti-aging or biohacking routine. They highlight its effects on blood flow, energy, urinary health, and even exercise recovery, positioning it as a kind of daily supplement rather than a prescription drug. For many, this rebranding makes Tadalafil feel less like medicine and more like a secret performance enhancer. 2. The rise of telemedicine. Online men's health clinics have exploded in popularity. With just a few clicks, men can get prescriptions for Tadalafil without the discomfort of discussing ED face-to-face with their doctor. Daily subscription models make it easy, discreet, and automatic, fueling long-term use. 3. The psychological comfort factor. For men struggling with ED, the idea of being always ready provides huge psychological relief. Daily Tadalafil removes the planning, the timing, and the anxiety of, will it work this time? That confidence boost alone is enough to hook many users into sticking with it. 4. Peer pressure and word of mouth. Let's be honest, no man wants to admit weakness. So when one guy says, I take Tadalafil every day and I feel amazing, others listen. This whisper network, from gyms to online forums, has helped daily Tadalafil become a quiet trend among men in their 30s, 40s, and 50s. But here's the twist. While the benefits sound tempting, the truth is more complicated. Because when you take Tadalafil every single day, your body adapts, and that adaptation comes with side effects that can start sooner than you think. In the next chapter, we'll uncover the immediate side effects of daily Tadalafil use. What can happen within the first weeks? Some of these might surprise you, and some might scare you. So far, daily Tadalafil sounds like a wonder drug. But let's flip the coin, because just like any medication, it comes with side effects, and some of them show up in the very first days or weeks of use. 1. Headaches and migraines. This is the most common complaint. Since Tadalafil widens blood vessels, it can cause a sudden change in pressure inside your head, leading to persistent headaches or migraines. For some, these fade with time. For others, they're a deal breaker. 2. Muscle and back pain. Up to 6% of daily users report muscle aches, stiffness, or lower back pain. This happens because of how Tadalafil affects smooth muscle tissues throughout the body, not just in the blood vessels. 3. Indigestion and acid reflux. Because Tadalafil relaxes smooth muscles, it can also relax the lower esophageal sphincter, making it easier for stomach acid to rise. Result? Heartburn, indigestion, or bloating, especially if taken after large meals. 4. Nasal congestion and flushing. Increased blood flow in the nasal passages can lead to stuffy nose, sinus pressure, and facial flushing. It's harmless, but uncomfortable, and for daily users, it can become frustrating. 5. Dizziness and lightheadedness. Since Tadalafil can lower blood pressure, some people feel dizzy, lightheaded, or even faint, especially if combined with alcohol or blood pressure medication. This makes driving or exercising risky until the body adjusts. 6. Visual changes, rare but concerning. Some users report blurred vision, sensitivity to light, or a blue tint to their eyesight. This is rare, but if it happens, it's a red flag that requires immediate medical evaluation. Quick warning, these side effects are usually mild to moderate. But here's the catch. When you're taking Tadalafil every day, the small side effects can add up, becoming part of your daily reality. And that's where long-term risks begin to creep in. In the next chapter, we're going to uncover the hidden dangers of long-term daily Tadalafil use, the risks most people don't think about until it's too late. Daily Tadalafil may seem safe at first glance. After all, millions of men have used it worldwide since its approval. But long-term daily use raises questions that science is only beginning to answer. Here are the hidden risks you need to know. 1. Cardiovascular strain. Yes, Tadalafil improves blood flow, but constant dilation of blood vessels can create a chronic demand on the heart. For men with undiagnosed cardiovascular problems, this could increase the risk of arrhythmias, fainting, or even cardiac events. It's no coincidence that Tadalafil is strictly contraindicated with nitrate medications, which are used for angina. The wrong combination can trigger a dangerous drop in blood pressure. 2. Hormonal and psychological dependence. Daily use can create a psychological dependency, where men feel they can't perform without it, even if their ED was mild or stress-related. This can erode natural confidence and intimacy, replacing it with reliance on a pill. There are also concerns about subtle changes in testosterone and other hormones with chronic use, though more research is needed. 3. Impact on vision and hearing. Rare, but serious side effects include sudden vision loss, linked to a condition called NAIAN, and hearing problems. While uncommon, the risk may increase with long-term exposure, especially in men with pre-existing vascular issues. 4. Kidney and liver stress. Because Tadalafil is processed by the liver and excreted by the kidneys, daily use places constant pressure on these organs. For healthy individuals, this may not be an issue. But in people with underlying conditions, it could accelerate organ damage over time. 5. Masking of underlying conditions. This may be the most dangerous of all. Erectile dysfunction is often an early warning sign of cardiovascular disease, diabetes, or hormonal imbalance. If Tadalafil hides the symptom, the root cause might remain untreated until it develops into something far more serious, like a heart attack or stroke. 6. Tolerance and diminished effectiveness. Some men report that the benefits wear off after months or years of daily use. This suggests the body adapts, forcing higher doses for the same effect, which only increases risks. Bottom line, daily Tadalafil may look harmless in the short term, but the long-term picture is much more complex and potentially dangerous. In the next chapter, we'll talk about who should never take Tadalafil daily, the high-risk groups most vulnerable to serious complications. If you fall into one of these categories, daily use could be a real danger. While some men can use Tadalafil safely under medical supervision, there are groups for whom daily use is especially dangerous. If you fall into one of these categories, the risks can far outweigh the benefits. 1. Men with heart conditions on nitrates. This is the most critical warning. Tadalafil combined with nitrate medications, like nitroglycerin for chest pain, can cause a sudden, life-threatening drop in blood pressure. For these individuals, Tadalafil is absolutely off-limits. 2. Severe liver or kidney disease. Because Tadalafil is metabolized by the liver and excreted through the kidneys, men with serious impairment in these organs may struggle to clear the drug. This can lead to dangerous accumulation and toxicity. 3. Uncontrolled hypertension or hypotension. If your blood pressure is too high or too low, daily Tadalafil can make things worse. In some cases, it may push blood pressure to dangerously unstable levels. 4. Recent heart attack or stroke men. Recovering from a cardiovascular event are at greater risk of complications when taking a vasodilator like Tadalafil. Daily use could increase strain on the heart before it has healed. 5. Certain eye disorders conditions like retinitis pigmentosa or a history of optic nerve issues increase the risk of severe vision problems with PDE5 inhibitors. For these men, the chance of permanent damage is too high. 6. Men on multiple medications. Daily Tadalafil interacts with a variety of drugs, from antifungals to antibiotics and blood pressure medications. Stacking these without proper supervision can cause unexpected, even dangerous, effects. 7. Younger men with mild or stress-related ED. This may surprise you, but if your ED is caused by stress, poor sleep, or lifestyle habits, daily Tadalafil is often unnecessary. In these cases, relying on the pill may only cover up problems that could be solved naturally. Quick truth bomb. Just because Tadalafil is available online doesn't mean it's safe for everyone. For certain people, daily use could be the difference between a healthier sex life and a trip to the emergency room. Next, we'll shift gears and look at safer alternatives, both natural and medical, that can help with performance, circulation, and prostate health without the same level of risk. If the risks of daily Tadalafil feel overwhelming, the good news is there are alternatives. Some are medical, others are lifestyle-based, and together they can provide powerful results, often without the same side effect burden. 1. Lifestyle and natural strategies. Exercise regularly. Aerobic activity and strength training improve circulation, reduce blood pressure, and boost testosterone naturally. Balanced diet. Foods rich in antioxidants, omega-3s, and nitrate-containing vegetables like spinach and beets support blood vessel health. Sleep optimization. Poor sleep is a hidden driver of ED and low energy. Fixing sleep can be more effective than any pill. Stress management. Meditation, breathing exercises, and therapy can directly improve performance by lowering cortisol and anxiety. Many men who think they need Tadalafil daily actually see major improvements by dialing in these basics. 2. Natural supplements. With caution. Some evidence supports supplements such as L-citrulline and L-arginine, amino acids that boost nitric oxide and blood flow. Panax ginseng, linked to improved erectile function and stamina. Zinc and vitamin D, support hormone production and energy. Warning, supplements aren't risk-free. Always buy from trusted sources and check for interactions. 3. Medical alternatives on-demand Tadalafil or sildenafil. Viagra. Instead of daily use, many men do well with occasional dosing, hormone therapy, when needed. If low testosterone is the root cause, addressing that can solve the problem more effectively than PDE5 inhibitors. Vacuum erection devices, VEDs, mechanical, non-drug options that work surprisingly well for some men. 4. Holistic combinations. The best outcomes often come from combining moderate medical support with strong lifestyle changes. For example, using low-dose, on-demand Tadalafil while also improving diet, exercise, and stress control may deliver the benefits without the constant risks of daily exposure. Key takeaway: daily Tadalafil is not the only way forward. In fact, for many men, exploring alternative paths first may bring results that last longer, feel more natural, and protect long-term health. But here's the twist. There are situations where daily Tadalafil can be beneficial, even recommended, and when used correctly, it might even be life-changing. That's what we'll reveal in our final chapter. After all the risks and warnings, you may be wondering, is there ever a case where daily Tadalafil is the right choice? The answer is yes, but only for specific conditions, and always under the guidance of a qualified physician. 1. Chronic erectile dysfunction. For men with persistent ED who don't respond well to on-demand dosing, a low daily dose, 2.55 mg, may provide steadier, more reliable results. This can improve both physical performance and mental confidence, reducing anxiety around intimacy. 2. Benign prostatic hyperplasia, BPH. Daily Tadalafil is FDA approved for treating urinary symptoms linked to an enlarged prostate. Men often experience fewer nighttime trips to the bathroom, better urine flow, and improved quality of life. 3. Pulmonary arterial hypertension. At higher doses, Tadalafil helps lower blood pressure in the lungs and improves exercise capacity. This is a life-saving therapy for patients with this rare condition. 4. Cardiovascular research, still emerging. Some studies suggest potential benefits for vascular health, arterial stiffness, and blood pressure regulation. However, these uses are experimental and require strict medical oversight to balance benefits against risks. 5. Psychological and relationship benefits. For some men, simply knowing they are always ready can remove years of stress and anxiety around intimacy. When managed carefully, this confidence boost can positively impact mental health and relationships. The golden rule: daily Tadalafil should never be self-prescribed. When taken under the supervision of a doctor who evaluates heart health, medications, and overall risk, it can be both safe and effective. But without that guidance, the dangers can outweigh the benefits.
In just a moment, we'll bring everything together with a powerful conclusion, including a final warning, practical tips, and one surprising effect of long-term Tadalafil use that most people don't know about. So now you know the full picture. Daily Tadalafil isn't just a little blue helper. It's a powerful drug with effects that go far beyond the bedroom.
We've seen that it can improve circulation and urinary symptoms, offer relief for men with chronic ED or BPH, even play a role in pulmonary hypertension treatment. But we've also uncovered the darker side: headaches, back pain, and dizziness. in the short term. Long-term cardiovascular, kidney, and liver risks. Masking of serious conditions like heart disease or diabetes, and the trap of psychological dependence. The one surprising effect of long-term use. Here's the part I promised you at the start. Some studies suggest that long-term daily use of Tadalafil may actually desensitize blood vessel response. In simple terms, your body can adapt, making the drug less effective over time and potentially leaving you worse off than before you started. That's the hidden danger many men never hear about. What should you do instead? If you're considering daily Tadalafil, do not self-prescribe. Always consult a doctor. Explore natural strategies first. Exercise, diet, sleep, and stress control often fix the root of the problem. If you already use Tadalafil, monitor your health closely, especially heart function, vision, and liver-kidney health. And never ignore ED as just a bedroom issue. It could be an early sign of something much more serious. Your call to action. If this video helped you, don't keep it to yourself. Share it with a friend who might be secretly struggling. Drop a comment below. Would you ever consider taking Tadalafil daily? Or do the risks outweigh the benefits for you? And subscribe for more science-based health insights that could save lives. Next step for you. If you want to dive deeper, check out our next video on the silent early signs of heart disease that most men ignore. Because remember, erectile dysfunction is often not the problem. It's the warning. Stay informed, stay healthy, and I'll see you in the next one.